the Aging and Vision Loss National Coalition.
If you're interested in receiving continuing education credit, our opening code is Aging and Vision Loss.
Hello everyone, my name is Mark Reichert and I am the Interim Executive Director of the Association for Education and Rehabilitation of the Blind and Visually Impaired, or AER. And it's a pleasure to present to you today and to be sort of the ringleader for this presentation, which is an introduction to the Aging and Vision Loss National Coalition, laying the foundation for systems change. My collaborator in crime here for today, and perhaps more importantly for the monumental tasks ahead, is my friend and colleague Lee Nasehi. Lee serves as the President and CEO of Vision Alliance, and just as AER is a membership association, so is Vision Alliance. AER is the leading national and indeed international voice of individual professionals representing the professional disciplines all across the blindness and visual impairment field. And Vision Alliance is many things, but principally an association of the organizations, the nonprofit direct service provider agencies, and the regional and indeed national organizations who provide service in a broader sense, meeting the unique needs of folks who are blind and visually impaired through information and referral, product development, conducting research, engaging in public education, representing consumers, and the like. AER, as an organization, is a member organization of Vision Alliance. So if you are a CEO or a program leader, or indeed the boss of the operation, meaning that you're the frontline person doing the hard work out there, I'm smiling at all of you. We would encourage you, of course, to have your employer be an organizational member of Vision Alliance. If you are indeed one of those frontline professionals laboring in the fields and serve kiddos, working age adults, and older people who live with vision loss, we want you in AER. AER is a membership-driven organization, and we quite literally could not do it without you. So if you are not an AER member, please consider joining. If you are, thank you so much for your membership. And if you'd like more information about how to be an AER member and what's in it for you, I would certainly be delighted to talk one-on-one with you. So with that, let's get started on today's presentation. My job is an easy one because I essentially get to queue up other people to say smart things, and so let me do that by sort of giving you the roadmap for what we're going to do over the course of this session. So I'm going to say a few words a little bit about sort of the history and context of the creation of the Aging and Vision Loss National Coalition, and then we're going to hear directly from Lee Nasehi with a bit of an overview of the theory of change, sort of the framework that undergirds the work of the coalition, and a general sort of overview of how the coalition is functioning and what, from a planning and future direction point of view, what we can expect over the course of, frankly, several years from our coalition. Then we're going to hear a presentation from John Cruz, who I'll introduce a little bit later, who will acquaint us with, frankly, the scope of the challenge we have ahead by putting in your hands some specific data and analysis that will help all of us articulate the size and the characteristics of the population of older folks experiencing vision loss, and as well as how we can most effectively talk about and describe that population to policymakers and others with whom we need to make the case for expanded and improved services to that population. After that, we're then going to get into the sort of nuts and bolts, if you will, of the coalition itself. The coalition is structured into 4 committees as of now, and I'll describe those 4 committees in a second. But we will be hearing from the co-chairs of each of those 4 committees, who will describe not only the work that they're doing, but hopefully as they do that, make the case for why you might want to be part of their work as they take on the direct task of work product delivery and the like. And then finally, Lee Nasehi will wrap us all up at the end with some thoughts on where we go from here and how you can be involved in the coalition. Okay. So, what is this thing called the Aging and Vision Loss National Coalition? Well, for sure, the blindness and vision impairment field has worked on aging and vision loss for arguably throughout its existence, throughout our community's existence, but certainly over the last 30 to 40 years. And I don't want to say that our field has tackled this issue of aging and vision loss in fits and starts, but depending on what mood you're in, you might agree that maybe it feels like that sometimes. For sure, under the auspices of the American Foundation for the Blind, in certainly beginning in the late 80s and then into the 90s, forming a national agenda on aging and bringing all of the various stakeholder groups and experts together under one literal and figurative roof to think through what the sort of master plan ought to be. That whole effort certainly was productive. I think arguably the culmination of that work is embodied in the successful advocacy effort led by the American Foundation for the Blind in the late 90s and early 2000s to increase the amount of money that Congress appropriates every year to the Independent Living Services for Older Individuals Who Are Blind, or the OIB program, the so-called Title VII Chapter 2 program. Title VII Chapter 2, of course, essentially being the site to the Rehabilitation Act of 1973. I can brag on the American Foundation for the Blind because even though I worked for AFB for many years, I was not the lead staff making that increase in federal spending happen. Our colleagues who were involved in that effort at the time, Scott Marshall, Paul Schrader, Alan Dinsmore, really taking the lead from a public policy point of view on rounding up champions on Capitol Hill to increase federal appropriation from what it once was to at about $10 million to where it is today, which is just about $34 million in annual spending for the program. Any one of us would love to have $30-some million in the bank, but from a federal spending point of view, of course, to describe that amount as a drop in the bucket wouldn't even begin to come close to articulating how woefully inadequate that amount is to meet the needs of the millions of people who are older in this country who live with vision loss. That having been said, it was clearly that campaign was an unqualified success. It was a model of cooperation and collaboration across the entire blindness and vision impairment community. AFB for sure led the charge, but leadership in that sense really meant being a focal point for activity and the devotion of staff time, as well as, frankly, outside public policy counsel, what we might pejoratively refer to as a lobbyist, to help open up the doors on Capitol Hill and make the case. But clearly, it was a community-wide effort. And folks from the state agency, the state vocational rehab agency community, were front and center as partners, as well as our friends in the private agency community, consumers who are blind or visually impaired, individual members of AER for sure, were part of that effort. And so it really was an all-hands-on-deck experience, and over the course of several years, the campaign was really successful. One nerdy detail that I want to share with you, but I think it's informative, is that not only was the push at that time to increase the amount of money that we would be getting out of Congress every year for the older blind program, but we were pushing for that increase such that it would eventually be raised, that amount, that annual spending amount would be raised to the point at which certain formulas would kick in terms of how that money was to be distributed to states. So it wasn't just about, gee, we want more money. It was also an effort, a campaign to say, under the way the rules currently work, if Congress, if you would please, raise the amount of money that you're spending on this program, just for all the important reasons we've told you, but also because if you do, that will trigger certain dynamics within the program in terms of how monies would be made available to states, even especially those states that have that are smaller and might have particularly small populations relative to other recipients of those federal resources. So it isn't just about having your hand out for more money. More often than not, it's about how you affect structural change to programs using the existing rules, or perhaps even then fundamentally changing those rules. We didn't do that 20 years ago, but perhaps we need to now. And so one of the many things that we're going to be tackling in the Aging and Vision Loss National Coalition is, in addition to racking up additional resources, ponying up the dollars to help make things happen, what other structural things need to change? What programs don't exist today that need to exist? How do we take existing programs like the Older Blind program and others and more effectively mold them into programs that target resources to the population we care about in a much more effective and focused way? As you can tell from my comments, of course, I groove on the public policy process, but this coalition is not just about legislation, regulation, and nerdy public policy. As you will see throughout the course of this presentation, the breadth of this coalition is really quite significant, and it's really meant to be a holistic, comprehensive attack on the array of challenges that are inherent in the whole business of making sure that people who are older in this country, beginning to experience or living with vision loss, have their needs met. And how do we do that? Well, the coalition that we have formed is broken into 4 constituent parts led by each of 4 committees. Those committees are the Research and Data Committee, the Public Awareness Committee, the Committee dealing with Access to Quality Services, and the Committee dealing with Public Policy and Funding. And in a few moments, you'll hear directly from the co-chairs of each of those 4 committees, and we want to make sure that you're acquainted with who they are, what they do, and what they hope to accomplish. And perhaps as those presentations are made, you will be enticed into one or all of those committees' activities, but hopefully one will really speak to you, and that will be something that you will want to be more directly involved in as you hopefully favorably contemplate being an active part of the Aging and Vision Loss National Coalition. I want to take a brief sort of aside here and say, when I say we form the coalition, so many things in our field are partnership efforts, partnership-driven initiatives, and organizations' priorities change, staff change at those organizations. Time goes on, and over the course of time, for sure, we are in debt, as it were, to the American Foundation for the Blind for literally decades of leadership in this space. As the AFB has evolved, AFB invited VisionServe Alliance to assume primary responsibility for leadership in this area and to assume the role of coordinator and catalyst for a coalition like this. And it's gone through a number of iterations. At one point, we styled this thing the 21st century 21st century agenda for aging and vision loss. No matter what you call it, it's absolutely an essential function within our field. And I, for one, taking off all the various hats that I wear, as someone who's been blind lifelong, I want to thank and acknowledge VisionServe Alliance for stepping up and forming this coalition. It's been in existence for easily a year or more, but now here at the beginning of 2021, when this session is being put together for you, we are about to have our first meeting of 2021. The date of that meeting is January 22nd, Friday, January 22nd, from 1 p.m. to 3 p.m. Eastern. If you have seen the promotional information about this session and are listening to yours truly right now, then you are in the loops that you need to be in to have hopefully seen information about the coalition and how you can participate. Our hope in putting this session together is that this is a nice overview for you to listen to in advance of the January 22nd, 2021, 1 p.m. Eastern convened first meeting of this year. And I say first because it will be the first of many meetings, not only for the full coalition, but for each of those committees that I described a moment ago. If you are tuned into this session and you say, well, gee whiz, it would have been nice to have known about this coalition meeting. I didn't know anything about it, and I'm sorry I missed it, because here we are after January 22nd, 2021. How in the world do I get involved? Well, again, if you are accessing this session, we will make sure that in the accompanying notes and links, etc., that you will be able to know best how to connect up with the coalition and be part of the fun and the hard work. If all of that somehow doesn't work, you're most welcome to drop me a note via email and say, good grief, I would love to get involved, but I just can't seem to figure out how to find the front door or even a back door. If you drop a note to Mark, M-A-R-K, Mark at aerbvi.org, I'll be happy to connect you. So with that, let's then turn to the substance of the coalition. What are the goals? What are the objectives? How do we get there? How do you get involved? Well, I will turn the program over now to me.
We're going to talk about a 3-year effort we're all working to put together to make an impact on the lives of people, older people who are living with low vision, blindness, and other visual impairments. We're picking up an effort that was begun in this field many decades ago, but has lacked or suffered a little bit from the lack of attention. And all of us are very passionate about this for a number of reasons. First of all, older people living with blindness, low vision, and other visual impairment makes up the largest cohort of people living with vision impairment, far and away the largest cohort, as many as 12 million Americans today. And that is a much larger number than other segments of the population. But in spite of that, there are very minimal resources to be serving this population. And so at best, 5%, and I think that's a very generous suggestion, 5% of people, older people living with vision impairment, are receiving any kind of services that could help them cope and continue to live independent lives. So we formed the Vision Serve Alliance with a lot of people who care about this, formed the Aging and Vision Loss National Coalition last year. And we've been working very hard this year to pull together thoughts and a plan and a more coherent strategy forward. So I'm going to talk to you, first of all, about the theory of change that we articulate. What is a theory of change? Some of you are familiar with it, and we actually had a presentation on theory of change by a speaker earlier this year. But I think it's possibly still not well understood by many of us. So essentially, a theory of change is a comprehensive description and illustration of how and why a desired change is expected to happen in a particular context. It is focused in particular on mapping out or filling in what has been described as the missing middle between what a program or change initiative does, its activities and interventions, and how these lead to desired goals being achieved. So I'd like you to imagine a couple of physicists at the chalkboard. And on the chalkboard, they have scrolled this incredible theory full of very complicated formulas. And right in the middle of that, there's a phrase that says, and then a miracle occurs. And frequently, that is how we approach our work in the nonprofit field, that we want to change something. We know some things that we think will make a difference, but we haven't necessarily followed it all the way through and created a logic model to be sure that the efforts that we're putting into this are really going to result in the desired change that we want. The other thing that happens is we start to solve a problem before we think about the root causes and ask enough whys. Somebody, one of our presenters this morning talked about Toyota's approach to thinking through problem solving, asking the question why 5 times. Well, theory of change is a lot like that. If we start to build a bridge across an ocean, we would quickly think, that is not going to work. Maybe we should be building a boat instead of a bridge. So theory of change helps us prepare and frame and create a better approach. So I'm going to share with you a visual graphic representation that won't be accessible on here, so I'll talk through it, but we will share it in the resources along with all the documents we're going to talk about today that you will get at the end of the day. And that form that we share with you is accessible. So first of all, we have in our theory of change, a problem statement. And our problem statement is that age-related eye diseases significantly impair the sight of 12 million plus Americans 60 years old and older, and that prevalence will double by the year 2050. Without intervention, daily functioning, physical and mental health are greatly diminished and cost the economy at least $145 billion a year. And some of the bullet points under that are vision issues are absent from national aging and healthcare policies. Aging and vision loss is misunderstood by most. Inadequate and inequitable programmatic public funding, limited Medicare and Medicaid coverage, and lack of accessible transportation, housing, and information. In our theory of change, we believe that some of the most significant process and activities that we need to engage in order to achieve our long-term outcomes, which is older adults with vision loss will successfully age in place, be able to engage in meaningful activities by having increased awareness of and access to resources and professional vision rehabilitation. What do we have to do to achieve that? Well, we think they fall into primarily 4 large buckets. One around awareness, And one of our presenters on the panel this morning is going to talk a little bit more about that. Policy and funding, there's just a ton of work that we need to do in policy work to affect many things, not just funding, but funding, of course, is a big part of it because we are severely underfunded when we're talking about aging and vision loss. Data and research is the third bucket. There is much data that needs to be collected, standards developed, and research conducted, not just on specific outcomes, but service delivery systems, comorbidities. There's, when we asked the question why, we came up with a lot of reasons for us to conduct that research. And then access is the fourth bucket. We'd like to assure a no wrong door system so that older people who may be experiencing vision loss can get adequate and timely assessments and connected to the services that they need. So our theory of change is based on, if we want to achieve those long-term outcomes, we're going to apply activities within these four buckets and affect education and understanding, policy and funding, data and research, and access in order to affect the ability for our older folks to be able to get the services they need and develop the skills that they need to remain independent. So that's essentially it. That is our theory of change. Now, we have this on one page. I think it's notable that our original document, which we will share with you too, is many more than one page. We want to keep this simple and short for sharing with folks, but we have a lot more detail, as you can imagine. This is a complex issue, and so there's a lot of backup and background to this, and we will share that with you as well, so you can see what we're talking about here, have a much better understanding.
Thank you so much, Lee Nasahi, for the overview of the theory of change and the purpose and general thrust of the Aging and Vision Loss National Coalition. And thank you for the leadership that you've exercised since coming on board and taking the helm of Vision Serve Alliance in herding the cats and getting all of us together and mobilized to move forward on these very critical issues. We couldn't have done it without you. We're now going to turn to the very important topic of research and data and drill down a little bit into getting a much better feel for the size of the population and the characteristics of the population that we're trying to serve, and in doing so get a feel for how we can best articulate the needs of that population and to do it in an effective way. The whole business of both mustering and properly and effectively articulating research and data is so critical for any public policy effort. And there is no one better in the business than the gentleman whose presentation you're going to hear next. John Cruz has been for many, many years. He's retired now, or at least he says that he is. I don't think we necessarily believe him, but for the amount of work that he does. But John Cruz, for many years, served at the Centers for Disease Control and Prevention, I think arguably being the nation's single most brilliant one-man repository of data and analysis, understanding the population that we all care so much about. And in addition to his many years of service there, John has a background in our field, having run an agency for the blind, visually impaired, with respect to the older blind program and managing services to older persons. So we couldn't hope for any better than someone who has the academic and professional, as well as deeply personal commitment to our field. And with that, ladies and gentlemen, John Cruz.
The piece that I have been working on in regard to this project is trying to develop a national briefing paper. And yeah, so this is it. Good. And so we've called this product the Vision Impairment and Vision Rehabilitation in the Lives of Older People in the United States. And I want to, if you go to the next slide, I want to talk a little bit about the context of that. So what we've heard about is this is a theory of change. That is kind of a logic model to get us from where we are to where we want to be, which I think is, which I applaud every bit of that work. And then we heard about the 3 years work plan that gets us from point A to point B in this model. And I think the third leg of this major strategic effort, third leg of this stool, is to have a national briefing paper that describes the characteristics, circumstances, and needs of older people with vision impairment. So as we go to the next slide, so that was our context. And the purpose of this paper is to create a document to support policy and advocacy initiatives. So we want to have something that we can put into the hands of advocates. And I think the important piece of that, because we all do this already, I mean, there's nothing new in this, but we often don't have kind of consistent talking points. So when we talk about the number of people with vision impairment, we each hear a different number, and we quote that number, and so it may weaken us if we're using different numbers. So what I was trying to do in this document was to create consistent talking points, that is a consistent argument that we can use to advocate for increased services, and so we're not confusing others with a mixed message. And the other piece of this then is to supplement, not to replace, strategies to bring awareness to our various constituent groups. So I see this as a supplementary kind of an argument paper. So if you go to the next slide, please. So there are kind of three messages, I think, that we're trying to get at in this paper. One has to do with the magnitude of the need, and that is that we all know the population of older people with vision impairment is large. We don't know how large, but it's large. It's getting larger, and that population is not evenly distributed across the United States for some of the reasons that Jackie was mentioning: rural issues, poverty, race, ethnicity, that sort of thing. So it creates an uneven distribution, and that's kind of an important part of our argument, I think. And then the other piece of this, which we all know, is that vision impairment and aging is really complex, because vision impairment is occurring in the context of other age-related changes, and trying to understand those and identify or validate what we already experienced, I think, is important. So we know that older people with vision impairment are more likely to have chronic conditions. They're more likely to report poor health and poor health-related quality of life. And there's a essential kind of, don't overstate it, but older people with vision impairment are at high risk for depression, cognitive decline, and premature morbidity. So we already know those things. And the third key message in this paper is around vision rehabilitation, and that it in fact works, that it has the potential to improve the independence and quality of life of people with vision impairment. So that's what we wanted to do in this paper. And then if we go to the next slide, I'll give you a little bit of detail about that. So so this is the content of the paper. This is what the document looks like, and it's been downloaded. You can it's electronic format, so it can be improved. But anyway, so the population of older people with vision impairment is large. I think for our point of view, for our advocacy works, it's just real easy for us to get on the ropes when we're talking about differing population estimates. In fact, there are people who make a living talking about this issue, and I think I'm one of them. And so there's a lot of things that drive these different numbers. And in an effort to help clarify some of that, I'm doing a little primer that I promised to Lee that would just talk about how these various population estimates occur. so that you can kind of better argue why we're talking about those different estimates. So, but the number that we kind of selected for this report is a study that was done by Rohit Varma in 2015. And his numbers are pretty good, and I think, and certainly convincing, and they're well established in terms of how he created those estimates. So in 2015, Varma estimated there were 750,000 people in this country over the age of 60 who are blind, 2.91 with vision impairment, and 8.2 million people over the age of 40 who have vision impairment due to uncorrected refractive error. And then earlier, I think Jackie mentioned that, or Lee mentioned that we expect that population to double between now and 2050. And so in Varma's estimate, there'd be 1.7 million people who are blind, 6.6 million with vision impairment, and 16 million with refractive error. So the population is big. It is getting bigger, and that's one of the messages that we want to have in this paper. Then we go to the second, or the next slide. What we know is, and we know more now, is that the population is not evenly distributed. So I think one of the things that I want to share with you that you may not know is that the efforts to track data is becoming more and more granular. So the census is part of his survey, is the American Community Survey, and it provides county level estimates. And there is a question in that survey, I won't go into detail, but it asks, are you blind or do you have serious difficulty seeing? Which for our purposes is a pretty good question. And those questions have been asked for a number of years now. And so we can estimate population, we can estimate the population by age, sex, and I suspect race, ethnicity by county in every county in the United States. So it's fairly powerful data. There's also the behavioral risk factor surveillance system, which is administered by CDC, available in every state. And it asks the same question. And those data have been collected for a number of years now. And so that also allows for fairly granular analysis, either at the state level, regional level, or in larger metropolitan areas. And as that data increase, we can move toward more county level data. So there is the possibility of making the case for the differences in the population at the county level. And I'll give you an example. We just created a study that kind of looks like this one for the state of Georgia. The title of it is called 1 in 12, because 1 person in 12 over the age of 55 is visually impaired in Georgia. And we were able to estimate county level data, prevalence data for the state of Georgia. Be happy to share that with you. But then we go to the next slide. This shows a national map by county, indicating the prevalence by quartile, I guess, of vision impairment by quintile, I'm sorry, in the United States. So what you can begin to see, one is that the counties differ in size, so, but there are patterns where vision impairment is dramatically higher. So the darker the color, the higher the prevalence of vision impairment. So if you look across Appalachia, those regions, they're poorer. Some are more remote. There's lack of services, lack of access to care. Those counties have higher rates of vision impairment. Across the South, the deep South and South Georgia are higher rates of vision impairment. And then if you look along the border counties in Texas next to Mexico, those rates are higher too. So we can begin to look at this variation in distribution. And so when we start making a case, I think, for providing vision rehabilitation services, there are some areas in this country where the population is extraordinarily high and there's virtually no services at all. So if you go to the next slide then, so this is part of the story we're trying to tell. And then, I don't want to go into detail, into a great deal of detail, but I want to just share some of the specific variables that we're identifying in this paper as our advocacy tool to describe the population. So one of the things that I have been concerned with, and in the 45 years that I have been kind of in this field, is the presence of comorbidities among people with vision impairment. And we all know that, but now we have some data that really validate the concerns that we have. So what I've done here is I've just showed six conditions: stroke, arthritis, diabetes, depression, hearing impairment, and falls. And what we see is that about 7.1% of people without vision impairment report stroke. For people with vision impairment, is 14%. Among arthritis is 48% to 63%. Diabetes, as you kind of expect, is 19% among people without vision impairment, 28% for people with. Depression, it goes from 12% to 20%. And then about a third of people over the age of 65, this is all over age 65 data, about a third of people over the age of 65 have hearing impairment, and then over 50% of people with vision impairment have both vision impairment and hearing impairment. And then we mentioned falls a little bit earlier. I published a paper just before I left CDC that showed that 28.9% of people without vision impairment are likely to fall in the last year, whereas 47% of people with vision impairment are likely to fall. There's some very good reasons, for that, and I think as you see these data, you can each interpret why these numbers occur as they do. But anyway, so we have specific numbers, and you can take those numbers as a part of an advocacy effort. And then if we go to the next slide, another more dimensional concern has to do with health-related quality of life. And so we do have data that we can share on that. And so just real quickly, in this data, there were 3 levels of vision impairment: no vision impairment, a little vision impairment, and moderate severe vision impairment. And what you see is that the greater the level of vision impairment, the more likely people are, for example, to report fair or poor health. So 23% of people without vision impairment report poor health. 30% of people with a little vision impairment report poor health, and 43% of people with moderate severe vision impairment report poor health. So you can start understanding the pathway to this. They're more likely to have chronic conditions, and those chronic conditions lead to poor health. And then there's some additional data we're reporting from a study I did a number of years ago on frequent physically unhealthy days. It goes from 14% to 28% among people with severe vision impairment, or frequent mentally unhealthy days goes from 4.8% to 12%. So all these topics that we've been talking about are validated by available data that we have. So then if we go to the next page, I'll rip on through this. So then the last piece that we wanted to talk about in this presentation is the impact, the positive effect of vision rehabilitation. And so there are a number of talking points that we developed in that paper, talking about vision rehabilitation as a discipline, that there is a national vision rehabilitation network, that there are federal funds, but those funds are lacking, and that there is kind of this smattering of evidence of the effectiveness of vision rehabilitation. And I'm really glad, I think, that we're kind of weighing in on this issue of measuring outcomes, which is something I've been talking about for a long time, and I still think we can do that. And then we also, in this paper, somebody mentioned earlier about the importance of stories, and I sure agree with that. I think it's kind of stories that bring us into this field. It is stories that engage others. So one of the things we did in this paper were to kind of highlight profiles of 3 people, and we called it Meet Ann, Meet Stephen, and Meet Alex to understand that kind of human dimension of that. So I wanted to balance the data with some of the policy issues and some of the human stories. But the idea for this tool is that this is something that you can take with you in your advocacy efforts. I think just having a report that is sponsored by the Vision Serve Alliance really gives you credibility, and then you don't have to go out and do your own research to figure out what these numbers are. And so the take-home messages in this paper is that it's a large and growing population, not evenly distributed. Place matters. It's a high prevalence of chronic conditions. It requires, I think the point we want to make about that is that addressing the needs of people with vision impairment and chronic conditions really requires a very skilled and competent vision rehab staff. This is not easy work. You really have to be very sensitive and knowledgeable about not just vision impairment, but other conditions. And then in order to improve health-related quality of life, those are more systemic things, that require comprehensive array of interventions and changes in public policy. And then the last message was that vision rehab works. So if we go to the next slide, when I began in the field back in 1976, I think it was, there were no data, certainly not state level data that were available, and now we begin to have the power of having more granular data. So I think some of the things that we need to that I would like to help with, I guess is the way I put it, is that we do have multiple estimates of vision impairment, and there's reasons for that. And so I've proposed to Lee that we could do a seminar for those who might be interested to talk about how we come up with these estimates and some of the data that are available to you. I did mention the American Community Survey and the Behavioral Risk Factor Surveillance System, both of which I think are rich and can be mined. They're available in every state. Those surveys have very useful questions, and we can begin to generate granular data. So we're going to plan a webinar, but I'm always willing to talk to people. So if you don't want to wait for the webinar, give me a call and I'll be happy to talk to you about that. And then finally, just to close this out, I think this paper creates, could we have the next slide, creates for us a consistent set of talking points to influence policy and practice. It's now available on the Vision Serve website. You can download that. Also, you'll note for this session that there are supporting documents as well. So some of the research papers that have been published in scientific journals, and so you can get those without having to pay a fee to get them. This document, the core document, can be amended as we gain experience. So really eager to get feedback from people to see how it works for you and how it might be amended. And then finally, I just want to thank you as an audience for participating in this session and tuning in, and also thank my colleagues who helped move this project along. Certainly they made very valuable contributions at each stage. So, so if you have questions, call me now or stand by for one of the webinars later. So that's it. Thank you guys very much. I appreciate it.
Fantastic. Thank you so much, John Cruz, for that thorough presentation and for your leadership in our field. And wow, are we ever grateful that you're on our side. Let's continue the discussion about research and data, but do that while turning to now a little bit of a deeper dive into the 4 committees that comprise the work of the Aging and Vision Loss National Coalition. The first of those committees is the Research and Data Committee. John Cruz co-chairs this committee along with another colleague and friend that I know you will appreciate getting to know. I will let them introduce themselves to you and hopefully get you enthused to perhaps join with them in their efforts as they acquaint you with the goals that they are tackling this year as the coalition moves forward with its work. So over to the Research and Data Committee.
This is the Vision Serve Alliance Aging and Vision Loss National Coalition, and we are part of the Data and Research Committee. I'd like to introduce to you myself as one of the co-chairs. So my name is Jacqueline Borchert, and I am the Director of Operations at Vision Forward Association. In addition, I am very pleased to be joined by my co-chair, Dr. John Cruz, PhD, who was formerly with the Centers for Disease Control as a lead research scientist. Today, we're going to share with you 5 objectives for our Data and Research Committee.
The first objective, good morning, everybody. The first objective that we identified is to create 3 seminars on data and data-driven evidence for the membership of the Vision Serve Alliance. And we want to work in part with Dean Van Asdale, who's at Ohio State University. So one of the topics that we want to address is surveillance systems and state-level population estimates. We think that that will just help leadership at the state level understand what data are available and how they can use it, and how that might influence some of the policies within the state. Secondly, we've already identified a topic regarding race and ethnicity. It's possible for us to identify the prevalence of vision impairments by race and ethnicity by county in the country, and we haven't done that analysis yet, though we think it'll be very interesting to identify unmet needs and populations that are particularly at risk. And then other topics we will begin to identify through the year. So we want to have 3 seminars for you this year.
All right, so in objective number 2, what we would like to do is to assess some of the key research articles that look at information regarding the prevalence of vision loss and also the disparities that are experienced between individuals who are with or without vision loss. As John mentioned, there is some data out there, and there definitely are a number of research articles that are available as well. The challenge at this point is that there is not kind of a central repository for all of that information. So what we're looking to do is to create a bibliography of some of these key and most relevant research articles, and then would like to create a space where we can make the full accessible text of those research articles available to Vision Serve Alliance members. We see that this will be something that will be really valuable as individuals look to continue to work on advocacy efforts around the importance of vision rehabilitation services for individuals who are blind and visually impaired, but also will help in grant writing and other efforts as well. Moving on now to objective number 3. One of the things that we would really like to address in addition is to look at outcomes measurements as it relates to the effectiveness of vision rehabilitation services. This is really a key area because this is a way that we can show that our vision rehabilitation services are making an impact. So in an attempt to do this, we know that there are individuals and groups out there who are working on or have previously worked on outcome measurement development. And so we want to start by first getting these individuals together and holding some sort of telephone conference in order to ensure that we're on the same page in terms of this work that is being done. Following that, We would like to ensure that we can identify what are some of the key initiatives in this area, what is the work that's being done, and then finally, we'd like to then be able to make recommendations back to Vision Serve Alliance about how to best proceed with setting a standardized set of outcomes, and then also how we would look to collect and report on the data from those standardized research outcomes.
As Jackie mentioned, I think objective number 3 is extraordinarily ambitious, and that could be its own set of work for a work group over a couple of years, I think. The 4th objective has to do with the National Academies of Science, Engineering, and Medicine report on making eye health population health imperative. That was a study that was commissioned by CDC in 2016, and there's a chapter in those recommendations regarding vision rehabilitation. And what we want to do is systematically go through those recommendations and make those available to the network. And then number 5. A question that surfaces regularly is what kind of questions should we ask in surveys, and how should those questions be designed? Something that's occupied a whole lot of people over a fairly long period of time. So one of the things we want to do this year, and we've already begun to work on, is to identify a standard set of vision questions that can be included in community health surveys. And for example, if you can convince the aging community to add 1 or 2 questions about vision, what might they be? And some of the characteristics of those questions would be that they've already had cognitive testing, that they're valid and reliable, and that they already reside in other population-based surveys, so that we can compare some of the findings with these questionnaires with other data sets. So we've already made some progress on that, and probably has some recommendations in fairly short order. So we're moving on objective 5 already.
All right, so you got a chance to see a brief overview of the 5 objectives that our Data and Research Committee has for this coming year. So finally, we would just like to invite all of you to join us in this really important endeavor. We acknowledge that this is an ambitious agenda, and it's really important that we have other individuals to partner with in order to help to ensure that we can carry out this important work. For any of you who are leaders within your organization, we also invite you to look to encourage other staff members to participate as part of this committee. This data and research is really going to be important in driving all the other objectives and ultimately to the overall goal of the Aging and Vision Loss National Coalition, and really moving the needle in terms of providing services for older individuals who are blind and visually impaired. So thank you so very much for your time today, and we look forward to hopefully working with you in the future.
Thank you so much, Research and Data Committee co-chairs, for your report. Look forward to the work ahead. Let's now turn to the second of our 4 committees that make up the Aging and Vision Loss National Coalition. This one is the Public Awareness Committee, a broad topic but absolutely critical in affecting broad systems change. And it's my pleasure to introduce Sylvia Perez and Nancy Miller, who are the co-chairs of the Public Awareness Committee. Take it away.
Hi, I'm Sylvia Stenson Perez. I'm the director of the Older Individuals Who Are Blind Technical Assistance Center at the National Research and Training Center on Blindness and Low Vision at Mississippi State University. I am also a very proud AER member and a certified vision rehabilitation therapist with ACD-REP. The Older Individuals Who Are Blind program serves individuals 55 and over who are not seeking an employment outcome nationally. Unfortunately, this program only serves about 5% of people who are eligible for services. The OIB TAC seeks to ensure the effective and efficient performance of agencies providing services to older individuals with visual impairments. This includes state agencies and private agencies. We really want to make sure that people are aware of access services and also get high quality independent living skills training. Last year, when Vision Serve Alliance decided to take the lead with the Aging and Vision Loss Coalition, we were thrilled. We were also thrilled to become partners in that. Nancy Miller and I, Nancy, who will be speaking in a minute, and I are the co-chairs of the Awareness Committee. We feel strongly that the awareness of services is so critical. Again, less than 5% of people who could benefit from services are getting them. The Awareness Committee really seeks to ensure that individuals, their families, and local organizations such as social service organizations, aging organizations, and even community-based organizations know about services and can help people get the services that they need. We hope that you will consider joining with us on the Awareness Committee. The OIB TAC at the NRTC has an awesome project that we're working on in collaboration with the Aging Vision Loss Coalition. And this is the development of a national public service campaign. We will be developing TV commercials, radio spots, and of course, lots of digital media pieces over the next year. We plan to create toolkits that can be used by any agency providing services, providing independent living services to older individuals. And so participating on the Awareness Committee will really get you connected with this public service campaign and help you find ways to provide independent living services to our millions of individuals who are not getting services across this country and who are aging. Now I'm going to turn it over to my friend and colleague, Nancy Miller.
Thank you, Sylvia. I'm Nancy D. Miller, and I'm the Executive Director and CEO of Vision's Services for the Blind and Visually Impaired, located in New York State. I am also a proud member of AER since 1987, and I have served on both the international board and the New York State board of AER. I'm a licensed social worker in New York State, and part of the work that I do is to get the word out that there is help available if you are having difficulty with your vision, that it is not a normal part of aging. There are rehabilitation services available in every state that can enable older people who are losing vision to age in place, not move into a nursing home or into a congregate living facility unless they have other chronic health conditions. Part of the work that we do at the Awareness Committee, which is a volunteer group representing a national effort to try to bring attention to aging and vision loss, is to encourage allied professionals, older individuals themselves, and family members to refer for services in the local community. We worked on one approach to getting referrals, and that is a flyer that is available to anybody who would like to use it, again, to try to get the word out that if you can't see something, say something. This was designed to be shared, and each organization, provider agency is able to put their own contact information on the flyer. Visions actually added a narration and music, and once movie theaters reopen in New York, they have agreed to use this flyer and public service announcement to get the word out about services that are available in New York. So we ask you to join us in this effort. We are looking for volunteers to be part of the awareness committee, and you can reach us through AER. Just let them know that you would like to be connected with the Aging and Vision Loss National Coalition Awareness Committee. And thank you so much, and join our efforts.
Thank you very much indeed, co-chairs of our Public Awareness Committee. Such critical work that needs to be done in the whole area of public awareness to ensure that there's awareness of the need for services, the awareness of the services that in fact do exist, and then awareness of the lack, frankly, of services that are truly capable of meeting the needs of the size of the population that needs those services, but also the diversity of needs within that population. So a lot of work to be done, and I'm glad we've got the right people on the job to do it. Let's turn then to the third of our four committees. This one we have styled the Access to Quality Services Committee, and I will let the co-chairs tell you what exactly we mean by that. So Access to Quality Services Committee co-chairs, over to you.
Hello, I'm Ellie Dupre. I'm here with Neva Fairchild to introduce and attract you to the Access to Quality Services Committee of the Aging and Vision Loss National Coalition. I've been a member of the coalition for several years, having been an executive director of a lighthouse here in Florida, serving a large number of older individuals who are visually impaired. And I also manage the AER accreditation program. Neva?
My name is Neva Fairchild. I'm with American Foundation for the Blind, serving as the National Aging and Vision Loss Specialist. I'm also president of AER for the next year and a half, and I have been a part of the Aging and Vision Loss National Coalition since its inception, and actually was involved when it was the Aging and Vision Loss Agenda facilitated by the American Foundation for the Blind. I have a passion for working with people who are older that began with my service at the Center on Vision Loss for AFB here in Dallas.
So we have identified three focus areas or three objectives for our committee. The first one is that we will reach out to all personnel preparation programs at the universities to either establish or join a working group focused on aging and access to quality services.
So we all know that there aren't enough qualified personnel in the country to serve the older population who are losing vision later in life. And we want to promote this. We know this is necessary in order for people who acquire vision loss have the ability to continue to live full and productive lives.
Our second objective is we will seek opportunities to connect with federally qualified healthcare centers to increase access to vision care for older individuals and connect the federally qualified healthcare centers to referral sources such as the Aging Network and vision rehabilitation services.
The federally qualified healthcare centers across our nation serve many people who receive healthcare services through Medicare. Rather than having a standalone clinic with 2 or 3 doctors, they have huge clinics with lots of specialties, and some of them have optometrists and or ophthalmologists. We want to make sure that those folks know what to do when they encounter someone with permanent vision loss. Instead of saying there's nothing I can do to help you, they can make referrals to appropriate agencies. And we believe this is a place to start. It's not going to cover everyone, but it's a place to start. And that's what we have to do, is we have to take a step.
We will prepare a toolkit, this is our third objective, and recruit people locally to present at Aging Network conferences on a screening tool that is being developed by New View, Oklahoma, and in general, spreading the word about the screening tool and what the return on investment would be of using it.
So our idea is that folks go to service providers in the Aging Network, let's say, example, a meal program at a local senior center. And they either don't divulge that they have a problem with their vision, or the environment is so difficult for them to handle that they don't go back because of their vision loss. That could be transportation, it could be, 3 walls of windows that make it so glary they can't function inside. It may be people who don't know how to help them in a buffet line or a cafeteria line. Who knows? There's a variety of reasons that people who are blind or visually impaired are not availing themselves of services throughout the Aging Network. And we want to change that. We want to help Aging Network providers who, for the most part right now, say we don't have anybody who's blind or visually impaired, which we all know is probably untrue. And we want to help them to learn to identify these folks by adding some simple questions to their intake process, maybe outlining some behavioral observations that they can train their staff and volunteers to be aware of. We don't know. This toolkit is going to be what will empower them to identify people that they serve who are struggling with their vision, and then to answer the question, what do we do with them? First of all, we want them to make their environment friendly. And second of all, we want them to make referrals out to appropriate agencies in the area. And that's going to mean hooking them up with resources like the APH Connect Center and the Vision Serve Alliance network of agencies. This work is going to happen within the year 2021. And we desperately need your help to accomplish these 3 objectives. These are our first steps toward taking actionable steps toward making a change in our system and helping people who are older and losing vision to fully engage in life to their maximum potential.
Thank you, Neva. That's exactly what we're pitching. We're looking for people who want to help us with this big, audacious goal that we've set for ourselves. But shouldn't we all want this? Okay, there are so many more older people in our communities, in our states, in our regions, in our country, who are not close to services. They don't live near services. There are not enough people being prepared in our specific vision impairment specialties. but we can be resources and we can help people to work within their scopes of practice and be more effective and more inclusive and more welcoming and contribute to the quality of life of older people who are living with vision loss. So we are asking you to join with us on this project.
Thank you, Ellie. Well said. Thank you, everybody. Reach out. We need your help.
Yep. Looking for your emails.
Thank you, Neva. Thank you, Ellie, for your presentation. And now the fourth of our committees, this one near and dear to my heart, the Public Policy and Funding Committee. Yours truly serves as a co-chair of this committee along with Dr. Priscilla Rogers, and it's our pleasure to provide our update on our committee's work for you now.
Hi, everybody. I'm Pris Rogers, and I am co-chair of the Policy and Funding Committee for the Aging and Vision Loss National Coalition. The other co-chair is Mark Reichert, and you will be hearing from him in a minute. I'm right now the Aging and Vision Loss Special Advisor for AFB, and I have been working with the National Coalition for the last few years. What we're going to talk about today are the objectives that our committee are going to be working on for this next year, 2021. So I'm going to go first, and I'm going to be giving you the objectives, and Mark is going to chime in with his special take. So our first objective is we are going to complete an aging and vision loss, quote, message bill, unquote, that includes components that provide comprehensive services and supports to promote independence and quality of life for older people with vision loss. We also will hope to find a sponsor or support for this bill, and we will also include an ask for OIB funding, which we have not determined yet, but will need to do, and also possibly needed language changes in the Rehab Act. This will also include the need to get buy-in from blindness advocacy groups for the ask. Okay, Mark, over to you.
So, great, thanks. Mark Reichert here, Interim Executive Director with AER, and formerly a part of the Aging and Vision Loss National Coalition, among other things, as we have developed this partnership between AER and Vision Serve Alliance, which hopefully everyone tuning in to hear this presentation knows all about. And if you don't, stay tuned. But with respect to this first bullet, really excited to get working on this with Pris and our committee. I think some of you may be familiar with the Alice Cogswell and Ann Sullivan Macy Act. If you don't worry about it. If you are, then you know what a message bill is. It doesn't mean that we aren't serious about the legislation. It just means that the bill as a standalone piece of legislation is likely not to move or get on President Biden's desk anytime soon, that bits and pieces of it will be shoved into various legislative vehicles like the Older Americans Act or perhaps the Rehabilitation Act or other places we haven't yet further fully explored. And so then you might say, well, then what's the purpose of a message bill? The purpose of a standalone message bill that has all the various components that Pris was talking about and the goal that we've developed is to be a rallying point for our field, to say to the champions that we will be recruiting on Capitol Hill, these are all of the things that we care about. Here are our policy objectives, and they're not just a set of wish list items. We've done our homework to actually put operative legislative language in place. So that's what that bill is going to be about. What the contents of that will be are going to be developed over the course of time with our friends in the committee that Pris and I co-chair, and of course the entire coalition and all of our organizational partners as well. So we're excited about getting to work on that. Pris, back to you.
Thank you, Mark. Our second objective is to build relationships with key stakeholder partners, such as with other coalitions. For example, Prevent Blindness works a great deal with the Vision Caucus in Congress, and that may be one of the coalitions that we will work with to try to further this message bill. Mark?
Not much more to say here other than this is really where the hard work really kicks in. Not that writing legislation is easy, but relatively speaking, once you've decided on what it is you want and how you want to write it up, the next best thing to working hard on that is to work with others to find out how many people agree with you and whether you've crafted it the right way, whether it's a package that can be broadly supported, not just among blindness organizations, but other folks in the disability world perhaps, or certainly in the wider aging community with whom our coalition and all of our organizations, frankly, are going to be stepping up our communications and essentially courting them to be part of this whole effort. So that's going to be, it's a time-consuming process to do that, but absolutely key as we line up more allies who are willing not to just put their name on a paper that says they agree with us, but actually roll up their sleeves and join us in the fight. Back to you.
And our third objective is to develop supporting materials and tools that we can use and our stakeholders can use, such as one-pagers about our advocacy work. And also to start the development of an advocacy training program for older people with vision loss so that they can get involved in the work as well. What do you think about that, Mark?
Well, it sounds like a lot of work, but it also sounds like it's indispensable work. I mean, really, when I think about these three goals that we've developed, it's, what do we want? Who is going to help us? And what stuff do we need to produce to get there? And this third goal can be as big and involved as we need it to be. And there's going to be, this is sort of, all of these goals really are kind of a hands-on deck exercise. It's not going to be one or two people doing it. But this third one for sure, in terms of developing supporting materials, that's going to involve a lot of us working together on that. And Chris, I wonder if you might say another word or two before we wrap it all up about that notion of working the training piece and empowering seniors, older folk who are experiencing vision loss in their families. Because I know you have passionate feelings about that, and I know of nobody better who would be ideally suited to help make that happen. So just maybe mention a word or two about that.
Sure, Mark. As you know, I've been very interested in the advocacy work and working with older people for my entire career, and that's what makes me so excited about what we're trying to do through the coalition and this particular goal that we're working on. And I think that it's really critical that older people who are involved in these programs and who receive the services have an opportunity to give back and to feel empowered. And a lot of them want to be involved in trying to help further the cause, and I can't think of a better way to make it happen than to get people involved who are actually experiencing vision loss and who have received the important services that they need to continue to be independent and lead fulfilling lives. So I'm very impassioned, as you would say, about getting that whole program started. And thanks for giving me the opportunity to say that.
Absolutely, for sure. We'd be remiss if we didn't. And I suppose the wrap-up point is that we call this little committee the Policy and Funding Committee, and they're not two separate things. I mean, they're intimately intertwined, if you will, but for sure, those sort of overarching definitions, if you will, of what it is we're trying to do, especially with that first goal in terms of what specifically do we want. There's going to be substantive policy stuff in there, and there will be specific recommendations or calls for lawmakers to give this woefully underfunded system and approach to serving older folks much more resources than we need. But of course, it's the finer points, the proverbial devil in the detail that we need to talk about. And Chris, you mentioned the older blind program. For sure, that's going to be part of our efforts. But we've talked about other things too, like beefing up research, supporting the establishment of a leadership program, so the next generation of doctoral level folk to do research and train the next generations of folks in our field. Maybe just reflect for a minute or two about that, and then we'll close it up.
Yes, I think it's really important that we get people in the next generation involved in aging and vision loss. And I'm very excited about the fact that our coalition is looking toward setting up some kind of a leadership program to get the next generation involved and having more people learn about aging and vision loss and in a holistic type of way, because I think that's been missing. We haven't really looked at this whole situation holistically across our field, and that's just a critical thing for us to do. And then, of course, the research. Vision always gets left out of the research, and somehow we've got to get it in. It's just so important that that happen. And that will be happening, we think, in other parts of our agenda that we're going through with our coalition, but it's part and parcel of what we're talking about with policy as well. So thank you, Mark.
Thank you. And I suppose we should say to people who've tuned into this, if you want to chit chat with us, get involved in our committee, get involved in this Aging and Vision Loss National Coalition, there's lots of doorways to get into that effort, but for now, we'll just leave you with, I guess, our email addresses. And mine, of course, is Mark, M-A-R-K, at aerbvi.org. And Pris, why don't you give them yours and say goodbye?
I will do that. Mine is Pris Rogers, and that's all one word, P as in Peter, RISROGERS @gmail.com. So looking forward to hearing from you.
Thank you very much, Pris and Mark, for that overview of the Funding and Policy Committee. And thanks to all the steering committee members who shared information with you all through this video. So there you have it. You have the purpose and the direction we are moving and something of the structure we will be using in 2021 for the Aging and Vision Loss National Coalition. Now what? Well, we're hoping that following you viewing this video that you are interested in getting more involved. So if you have not already registered and you're available, we'd very much love for you to participate in our kickoff meeting for this year for the coalition, which will be Friday, January 22nd from 1 p.m. to 3 p.m. We'd like you to register for the meeting. We'd also like you to think about which of those 4 committees you most align with and would like to spend some time working with. And if you can indicate that in your registration, that will also be helpful, because we're actually going to break out the committees during this meeting and do a little bit more work on the planning of what exactly we're going to focus on in the next 90 days. So we hope you are interested. If you have any questions, you can contact me before the meeting. We'd love to have your input and you be able to hit the ground running prior to that meeting. So if you have any questions, anything you'd like to discuss, please feel free to reach out to me in the meanwhile. And join us on Friday, and together we are going to make a difference for people who are older and living with vision loss, blindness, and other visual dysfunction. Thank you very much. Talk soon.
Thank you for joining us for our video introducing the Aging and Vision Loss National Coalition, laying the foundation for systems change. If you're interested in receiving continuing education credit, our closing code is National Coalition. To receive credit, please email both the opening and closing codes with your AER member number, if you have one, to megan@aerbvi.org. That's MEGAN@aerbvi.org.